Arteriovascular malformation, AVM, is a tangle of blood vessels that has specific symptoms, diagnosis, and treatments. I have lived with AVM for 7 years, and I will for the rest of my life. Today, I'm going to inform you about AVM and how I have been affected by it. In the last 7 years, I have had 5 major procedures for my AVM at the University of Michigan in Ann Arbor, Michigan. I will be discussing the symptoms, diagnosis, and treatments of AVM. The type of AVM that I have is spinal arteriovenous malformation. It is a rare, abnormal tangle of blood vessels on, in, or near the spinal cord. The vast majority of spinal AVMs will cause neurological symptoms, such as back pain, sensory loss, and weakness in the lower extremities that worsen over months and years. Some gradual symptoms can occur are problems walking, climbing stairs, numbness, tingling, sudden pain in your legs, weakness on one or both sides of your body, and lower back pain. My symptoms were, and still are, pain in my lower back, my legs, my hands, they go numb. And the left side of my back is swollen and very sensitive to touch. These symptoms were the main reason I received help from the doctor. Only MRIs can be used to identify a malformation, then a spinal angiogram is used. A spinal angiogram is a test in which a tracer is injected to make the flow appear on an X-ray to access the structure of malformation. I have had 11 MRIs and 5 spinal angiograms done. These were done to help my doctor with my treatments. For most AVM, surgery is not an option. The reason for this is because an AVM deals with many blood vessels. With surgery, there's a possibility that a patient could bleed to death. A non-surgical method of closing down the blood or lymph flow to the malformation is done by interventional radiologists who treat patients with image guide procedures. Vascular malformations are treated by an endovascular embolization. An endovascular embolization is when a catheter is inserted in an artery in your leg and threaded to an artery in your spinal cord that is feeding your AVM. Platinum coils are used to block through the feeding artery to the malformation. I have 9 platinum coils inside of me, and I still have small blood vessels wrapped around my spinal cord. I have to go every year for an MRI to keep track on if there are any changes. In summary, arteriovascular malformation is a rare disease with serious symptoms, diagnosis, and treatments. There are different types of AVMs, but I have covered information about spinal arteriovenous malformation. As I stated before, I was diagnosed with AVM 7 years ago. I've had 11 MRIs, 5 spinal angiograms with embolization. I have 9 platinum coils inside of me, and unfortunately was paralyzed for a week after one of the procedures. Thank you.